Hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon, and I'm the surgical director of Aurora clinics. And today I'm going to be talking about how we manage hypertrophic and keloid scars. So in previous videos on sort of scarring, I've talked about why you get scarring, what you can do to reduce it, the difference between hypertrophic and keloid scarring. But essentially, hypertrophic scarring is scarring which occurs within the normal scar, normally in young people, often with a history of sort of slow healing or problems healing, such as an infection, but is limited to within the scar and will tend to get better with time. Keloid scarring tends to occur in people with much darker complexions and is started by a normally very small amount of trauma, like piercing ear or a hair, ingrowing hair, and this is almost like a benign tumour which grows outside the original area of scarring. Okay, so hypertrophic scarring is slightly excessive scarring. So what can you do? The first thing is massage is very important. So I tend to encourage my patients to massage the scar with bio oil, and this really has a dual action. Number one, the scar helps remodel and settle the scarring area down, and the bio oil actually has vitamins and various things specifically designed to help scarring. Okay. It's very important to touch the scars because sometimes people don't touch the scars and they become oversensitive. So basically, if you don't touch anything, the body upregulates the sensation, so it becomes more sensitive. Okay, so you need to desensitize the area by touching it. It might be a bit uncomfortable, but if you touch it, it will desensitize. Okay, it's very important to massage and touch these scars. Okay, so hypertrophic scars, I think that taping them for a prolonged period of time, taking the tension off them is very important. Okay, once one is developed, tension won't, the taping doesn't help so much, so it's really a matter of massage. We can use silicone gels or silicone sheets. Okay, now silicone helps the scars. It's not really known how it does it. Maybe by hydration from the silicone ions, or maybe the pressure. But silicone does seem to help. There are a number of silicone gels which you can apply to the scar, and there's also a sheet, the best known of which in the UK is called Care, C-I-C-C-A-R-E, and this is a silicone sheet which you can buy from the chemists. Basically, you cut it into, you get a big sheet, you cut a bit the size, a bit bigger than your scar. It's got a sticky side on one side, the sticky side on your scar. Wear it under clothes, and then when it loses the stick, discard that bit and go for another piece. So that's what we try initially normally. So normally initially, massage, that doesn't work. Next stage is the silicone gels. If that doesn't work, for hypertrophic scars, we're really looking at some sort of process to modify the scarring, and that's normally an injection actually into the scar of a very mild steroid. And the one we normally use is triamcinolone, which is 10 milligrams per mil. For much bigger scars or keloid scars, we tend to use a variety of steroid which is 4 times as strong. That's the 40 milligrams per mil variety, which is called Keloid. Anyway, so we normally start off with injections about a quarter. We inject that actually into the scar, and that has a number of effects. Number one, reduces itching. Number two, flattens the scar, and number 3, normally decreases the colour of the scar. You've got to be careful, you've got to do it slowly because it's very powerful. And if you use too much, we can actually convert a raised scar into a depressed scar. So we need to do that slowly. Normally we have course of steroid injections 6 weeks apart because the steroids take an average of 6 weeks to work. And normally we can get the scar pretty much flat in those cases. There may still be some blood vessels on it, which we can normally treat with laser therapy. So the steroid reduces the prominence, laser therapy reduces the redness of the scar. So hypertrophic scars are manageable, but the earlier you get them seen, the better. Keloid scars are much more difficult because they're going to keep on growing, almost like benign tumours. Difficult to treat. We normally start off with steroid injections. That's the triamcinolone. If that doesn't work, we go up to the Keloid. If that doesn't work, we really need to be thinking about removing the keloid. The problem is, if you remove it, it can actually come back bigger, which is the problem. So if we remove it, we can remove it. Very important to keep the scarring as minimum as possible, so no scarring on normal skin. Remove the keloid. then we're left with the small scar, and we need to treat, and we need to reduce the scarring response. And normally we either do that a number of ways. One is with pressure, so particularly on the ear, we have special earrings which put pressure on the area, which keep it compressed. Number two is with steroid injections. Even if it's not too lumpy, we can give it a course of steroid injections very early to try and damp down the response. And the final way is with radiotherapy. And radiotherapy reduces the sort of turnover of the skin and reduces the formation of the keloid. However, radiotherapy, particularly in young people, has potential implications on skin cancer and things at a later date. So we need to think really carefully about radiotherapy, and it needs to be planned. So I hope that's made it a bit clearer. I mean, we're constantly trying to improve scars. There's a lot of science, a lot of research going on how to modify scars. I spent a year of my life looking at ways to modify this with different factors. So we're constantly trying to modify scars, and I think there's a lot of hope in the future for making scars and being able to modulate them and control them. But at the moment, if you've got a scar you're worried about, the real take-home message is come and see a plastic surgeon sooner rather than later so we can get early treatment. So I hope that's been helpful. If you'd like any information about any aspect of cosmetic surgery, we have a number of specialists at Aurora clinics who specialise in different areas. One of them is more than happy to see you or discuss any issue with you. We're always happy to get any contacts via email, or just feel free to ring us on UK number